Let me just tell to our clients, I'm very honored to have Dr. Charles Wile on this podcast today. Dr. Wile is a retired Air Force colonel and a physician of decades of experience and one of my best friends and co-workers at our clinic. And he has built up a reputation in many areas. Every time I talk to Dr. Wile, I always learn something. It's so wonderful to have Dr. Wile on our team. And Dr. Wile, today we'll start with our regular podcasting, video podcasting, by talking about the hormonal balance in the anti-aging in our chronic disease management area. All right, Dr. Wile, go ahead.
Yes, hello. I find this to be a very exciting topic because I've personally been using hormone replacement therapy myself for over 10 years and using this with my patients for that period of time. And I feel that it's a remarkable tool that we have available. And I want to talk today about bioidentical hormone replacement therapy in women in particular. It's available for men and women, but I want to focus on women today. And we're going to just do a brief introduction and put it in context within the framework of the way we are now approaching patient care. Had I started out my career knowing about functional medicine back 40 plus years ago, I would have probably gone into this approach. They didn't even have anti-aging medicine, and they certainly didn't talk about preventive and regenerative types of medicine back when I was in medical school. But it's now very exciting fields, and they link well. Functional medicine looks down at getting to the basic idea of what is actually going on in terms of the context of a problem. And if you're just symptom treating, all you're doing is trying to put a Band-Aid over a bleeding wound. When you deal with functional medicine, you're getting down to the basics. What is the cause? Because until you can at least understand the cause and process, it's hard to know how to develop a individualized way of helping someone to improve and augment their health. The idea of preventive and preventive and restorative medicine, which is where the context of bioidentical hormone replacement therapy fits nicely, is one that I like to start with because hormones act on the body very quickly. And so if somebody's coming in feeling terrible and we've identified the context of the problem as being a hormone deficiency due to the normal, ordinary process of getting older, of aging. We can't stop aging, we can stop getting old, but we can't stop the aging process, but we can support the healthiness as we mature into our later years by maintaining hormonal support for both men and women. And anti-aging medicine, and it truly is a reality now, looks at not only the prevention of chronic diseases, but it looks at ways of reversing the process of aging itself so that not only is our lifespan extended, but our health span is extended along with it. What good does it do if we live a very unhealthy and painful old age? We want to live to be a healthy and vibrant kind of person as we age. And so I want to just stop a minute and say why I refer to bioidentical hormone replacement therapy. Bioidentical hormones simply mean hormones that we take orally or topically or by injection that are absolutely identical with the hormones produced by the endocrine glands in our bodies, that our bodies have known for millennia how to effectively metabolize them and keep us into a healthy homeostatic balance. Exogenous hormones that have been manipulated by humans in order to patent them and make money do not get metabolized the same way, and therein lies a lot of the consequences for bad outcomes and bad side effects. And so I only use in my practice bioidentical hormones because the body knows how to use these. They work quickly and they have minimal side effects compared, and it's always a risk-benefit analysis, comparing doing nothing where you're having hormone deficiency and the consequences of hormone deficiency, which include degenerative processes, increased inflammation on all systems in the body. If we can maintain our hormone balance within a healthy range, we can keep the cells of all our systems operating the way they were designed to for our functioning. So I basically wanted to identify kind of some of the red flags that a woman can look at that might suggest there's a problem with hormone deficiency. And this is what we call perimenopause. Menopause is a specific definition where you are without a menstrual flow for a 1-year period of time. And in addition to that, there's an increase of the hormones from the pituitary gland in the brain that are throwing out massive amounts of stimulating hormones to try and get the aging ovaries and testes to start and maintain their function. When that physiologically is shutting down, some of the symptoms that go along with this perimenopausal period, the period of time that precedes menopause, and this can last for a brief period of time of several months, but typically it's several years. And some of the initial symptoms of this hormone deficiency include hot flashes and night sweats, where without the hormonal support, particularly of estrogen and progesterone, the blood vessels will not be supported well. And one of the consequences is they will spontaneously lose their tone, dilate, and the body is now responding in the skin with this sense of being overwhelmingly hot and unable to get comfortable. You see in movies and TV where women are standing in front of an open refrigerator and freezer in order to get cool. This is that time of life where you have this hot flash and night sweats. Additionally, there are changes in mood because the hormones affect the physical aspect of our bodies, the emotional aspect of our bodies, and they up and down moods are very common. Sleep disturbances, not only because of the night sweats and the hot flashes, but there's a direct effect of the hormones on how the sleep mechanism in our brain functions. There's an increase oftentimes of anxiety. Progesterone is the woman's #1 hormone for being cool, calm, and collected. It's an anti-anxiety effect. And so when the first hormone to begin dropping off, which is progesterone, is no longer available, there's going to be changes in mood, there's going to be an increase in anxiety and irritability, and a decrease in sex drive, a decrease in libido. As this progresses, there'll be changes in menstrual periods because without the progesterone to modify the lining of the uterus, which is built up by the estrogen in preparation for ovulation and implantation of an egg for possible pregnancy. Without progesterone there to modify the lining of the uterus, then the uterus will continue to, the lining will continue to build up until it can no longer just be supported by the estrogen itself, and then it starts sloughing off in periods of spotting and irregularity. Also, other key symptoms would be a decrease in energy, enthusiasm, a sense of lethargy and depression, and changes in skin and hair, decreased stamina and energy, constipation. These are all problems that can be explained by other types of problems. And so before we jump in to using hormones for replacement, we need to rule out, that makes no other possibilities as the primary cause for these symptoms. And we use predominantly what somebody tells us they're experiencing within the context of their lives and how they are living their lives. But we use laboratory studies as a guidance tool to make sure, number one, that the diagnosis is correct, and number two, to guide our treatment. So when there is this perimenopausal period and a drop off in the sex hormones, and that's all I'm going to talk about today, the sex hormones in women, and specifically they include estrogen, progesterone, and testosterone. Yes, women have a very significant need to have testosterone in appropriate dosage flowing through their systems as well. The drop-off in these hormones results in an increase in our stress response and an increase in inflammation. And these two things, a decrease in our ability to respond to stress, which are supported by the sex hormones, and not just the thyroid and the adrenals and the pancreas for insulin. When you lose the sex hormones, you also decrease energy and flexibility and the responsivity to the stress response. And we've all been under a lot of stress with COVID and other things of late. When this happens, the result is degenerative diseases that we typically associate with aging. Predominantly the cardiovascular diseases, which are the #1 cause of illness and death in both women and men. You have osteoporosis, where the bones start thinning out and becoming brittle. Cognitive dysfunction and dementia are associated with this. A variety of cancers, and what's obvious is a wrinkly skin and dry skin. So when you've got these physical signs that go along with the experiential signs of the symptomatology, then if it's identified by the history and by some basic lab testing, not the type that your primary care physician typically orders, but those are important as well to make sure that we're dealing with the correct diagnosis. Once you make a decision that what seems to be the most problematic aspect of what's going on is a drop-off in hormones as a result of perimenopause moving into menopause, then we make a decision plan on an individual basis. And the reason I choose to start with offering bioidentical hormone replacement therapy and not just simply overwhelming people with improving exercise, improving diet, enhancing sleep, increasing hydration, improving breathing, improving meditation, and ways of spiritual connection, all of which are absolutely keys and fundamental to overall health and well-being. The reason I start with the hormones is because they work so quickly. I'm talking within days to weeks of initiating first supportive and then replacement doses, depending on where a woman in this case is with her hormone deficiency. And then once they start feeling better, their motivation improves. The very fact that here you have actually helped them, they're no longer having the hot sweats, they're sleeping better, their energy's improved, their sex drive is improved, and they're generally feeling better in this quick way, not just with a dietary change that may take months to manifest. Then they're going to be much more receptive and interested in hearing, what else can I do to keep this going? Because this is a good direction to be going in. And that's when I can then introduce these other fundamentals, because it's a holistic approach. There's no one way. It's a blending, it's a synthesis and a balancing act of these other fundamental aspects that need to be tailored to the individuals, not only their genetics and the way patterns that may have been evident in their family history, but can they afford it? I mean, insurance does not pay for this. This is one of those out-of-pocket things that is well worth it. And having the years now, over decades of experience with using this approach, it becomes very important to be able to select cost-effective ways that are efficacious, that really work, but people have to be able to afford them to be able to have them work. So compliance is key. And the best way I know for enhancing compliance is being a good coach and cheerleader and making them affordable so that they can be sustainable. Because the approach is not like even some of the established medical organizations have been promulgating. It would be almost criminal to treat somebody with type 1 diabetes who needs insulin, and you can see their insulin level is low, and so you work with them just for a limited period of time. Now they're back, you measure their laboratory tests, everything looks normal, they're feeling better, and then you stop. That's nonsense. The fact that the hormones have been depleted because of the aging process doesn't mean you just use them for a little bit of time to get them feel better and stop, because they're going to rebound and start feeling bad again, and you'll have all the consequences associated with the degenerative processes of inflammation that will proceed. So the way I look at hormone replacement therapy is this is a lifelong way of trying to do the best I can to maintain a healthy balance of the hormones so that the enzymatic functions, the proteolytic functions, the metabolic functions of the body all remain supported, and you can minimize and or delay and minimize the degenerative processes that do eventually catch up with us as the process of aging progresses. So then you have to realize, well, just the hormone itself isn't going to be enough. You've got to give the foundational materials for the hormones to work on. These are the foods, the vitamins, the minerals, various supplements, the building blocks. You get that added to the hormone treatment, and then you address all the lifestyle changes that are foundational for this approach to health. Timing is very important. If a person a woman is perimenopausal, and let's say she's 45 years old, and I start her on hormone replacement therapy, she's going to start feeling better because she's perimenopausal. We haven't even gotten to the 1 year without a period menopausal phase. We're going to be focusing on maintaining her health and well-being for a period of time. If I take a 60-year-old woman and start the process, she's had 15 additional years without hormones, and the inflammatory processes are going to continue, roaring without that breaking hormonal experience, the delaying process, keeping everything healthy and in balance and flowing. And so there will be some buildup of atherosclerosis in the blood vessels. There will be consequences, perhaps, that will cause some cognitive impairment and increased risks for strokes. There will be loss of the physical strength and endurance in the muscles and joints of the body. So timing is very important. The earlier that this replacement starts, overall, the better. That's not to say I can't start and wouldn't start someone who is older. I just need to have a little more cautious approach because some of these degenerative processes have already been kicked into gear, and don't want to overload the system. So I have to take it actually a little bit slower, a little more gentle approach, rather than trying to correct everything all at once, which never works well. So the earlier the better, and we're guided in this regard. And I see my role as an educator, coach, a cheerleader, someone who can be a resource, because the actual doing is a daily process. Every individual makes the commitment, not only monetarily that they're making this as a long-term commitment, but they're incorporating this within their daily routines for grooming, etc. And I think this approach ensures an optimal way of using, restoring the hormones to an optimal range. Then we'll add good nutrition, regular exercise, avoiding, eliminating toxins, and developing spiritual practices, all of which are absolutely key, including monetary awareness and community involvement. Using this approach is not new. This has been available for many years. This is rather an improved and more effective way of using hormones within a holistic context. And it focuses on prevention and restoration of health. In this process, there will be decrease in inflammation and improvement in our natural body defenses, so that hopefully there'll be much less need for disease medications. And consequently, even though the outlay initially seems out of pocket and expensive, when you look at this in terms of a long-term approach, it's very, very cost effective. You don't have the problems of premature disease and the associated expenses that come with the costs necessary for medications and surgery, etc. So it is a cost-effective approach, but it has to be within the context of a long-term approach. This is evidence-based. There's literature that is just, now it gets to the point of being overwhelming in volume, that demonstrates this is not only the appropriate approach, but it's the smart approach to use. And knowing about how important these hormones are to health and well-being, we've also been able to identify not only the process of perimenopause, menopause, and andropause, which is the name for the same aging process in men, but we've been able to realize how we can use these bioidentical hormones in ways that are specific for problem solving. For example, the primary treatment for osteoporosis is bioidentical hormones, not calcium and vitamin D. Though we can talk about and will talk about bone health another time, but premenstrual syndrome, PMS, is treated this way. Polycystic ovarian syndrome is treated this way. I mentioned PMS and polycystic ovarian syndrome because these are two very bothersome problems for young women. And so knowing how to use hormones effectively, particularly progesterone, we can give relief to younger women who are identified with these hormonal problems of youth, such as PMS and polycystic ovarian syndrome. Anxiety can be helped greatly with this. Adrenal fatigue, fibromyalgia, and chronic fatigue syndrome, all of these things can be helped by using bioidentical hormone replacement therapy. And now I've learned how important it is to use a form of estrogen, namely estriol, for helping people who have autoimmune diseases, particularly as they manifest within the intestinal, gastrointestinal system. So using hormones can be a very beneficial and important first start. Unfortunately, it was back in 2002, so really we're talking 20 years ago, the Women's Health Initiative came out with a study that caused great fear in women throughout our country and the world, and throughout their physicians as well. And unfortunately, this, as we've looked at it over time, was a very poor study. They used the hormones that were most prescribed at the time, namely Premarin, which is derived from horse urine, estrogens in horse urine, which were largely estrone and equilin and equilinin, that are metabolized to problems that can lead to hardening of the arteries and breast cancer. Now, had they used instead estradiol, which is the most important estrogen that a woman produces, along with estriol, which is the metabolite of estradiol, they would have found something very different. Particularly, they also used what's called a progestin. A progestin is a man-modified progesterone molecule. Had they used a bioidentical progesterone, their findings would have been dramatically different. In fact, they've done this since then, where they've used estradiol and progesterone and found not only do they not cause hardening of the arteries and increased breast cancer, but they helped to delay and prevent the development of atherosclerotic cardiovascular disease and breast cancer. That is like 180 degrees from what that Women's Health Initiative study was saying. And now that we know how estrogen and progesterone receptors are working in the body, testosterone receptors are working in the body, and the importance of the breakdown pathways, we can understand why it's absolutely crucial to use bioidentical hormones and not man-modified hormones in order to get the positive effects that we're looking for. So let me just briefly talk about the three sex hormones for women. Let's start with estrogen. Estrogen, and whenever I prescribe for a perimenopausal and menopausal woman, I think in terms of estrogen and progesterone. I never want to prescribe estrogen without simultaneously prescribing progesterone to modify the proliferative effects that estrogen is supposed to do within the body. And so I think of estrogen and progesterone being prescribed together. Estrogen is needed to maintain a healthy cardiovascular system, bones, brain, and skin. And in a woman in her 40s, when the functional life of the ovary is diminishing, there will be wild up and down roller coaster production of estrogen during this time. And so testing labs can be very problematic and is not the ideal way of identifying what's going on. Listening carefully to what a woman is telling me is crucial to be able to make the appropriate diagnosis. And with actual menopause, then you know the absolute levels of the hormone are dropping off. I said the first hormone that's going to be affected is progesterone. Progesterone is necessary to modify the lining of the uterus that's being stimulated in growing in preparation for an egg to come and implant. Estrogen is turning on for that 14 days of the beginning part of the cycle. And when the woman ovulates, from where the egg pops out of the surface of the ovary, those cells now start producing progesterone. So progesterone is going to be virtually negative in the first 14 days. And then it becomes very, very important to cause that lining that was being stimulated and growing as a result of the estrogen. Now it's allowing it to modify with glands being produced to make it lush and ready to host an egg to burrow in and set up a pregnancy. If that doesn't happen for whatever reason, then the egg is going to start shriveling up and will be gone. And the hormones that are produced from where it popped out are going to drop off. And so by the end of the menstrual flow, which is triggered by that dropping off of the estrogen and the progesterone, then the whole cycle starts all over again under the stimulus and feedback system with the pituitary gland in the brain. So there are three estrogens largely that we think about in terms of a woman. The first is estrone, or E1, and this goes up in the time of menopause because the estrogen that is going to be most supportive is estradiol, E2, is dropping off. The estrone is produced not only by the ovary, but also in the fat tissue and the adrenal glands. And so it's the metabolism of estrone that leads to what women look at as a 217 balance in the metabolites of estrone. And you want to improve the good metabolites to protect the breast and minimize the ones that will cause the pathway to go towards the problematic metabolites of estrone. So that's E1, estrone. Estradiol is the most powerful estrogen that has its effect on the brain, the heart, and the bones. And the metabolite of estradiol, E2, is E3, estriol. Estriol is only about 20%, only about 1/20th the strength of estradiol, E2. And it is the estrogen that has the most potent effect on collagen, on the mucosa of the vagina, the intestines, of all the aspects of the body. So estriol E3, keeping that elevated is important for gastrointestinal health. If a woman is having problems with thin mucosa of her vagina, which makes having sex painful, the primary treatment is estriol E3 as a topical cream. And that's very important. The therapy goals are that the woman becomes symptom-free, that there is no bone loss, and we can do this with a simple urine test called the NTX. And we want to make sure that we get the estrogen, the estradiol level above 60. A therapeutic range is between 60 and 120. And depending on the literature, it may be variable, 10 points one way or the other. But by maintaining this hormonal level with estrogen, a woman will have an improvement of the impact of on her brain, her bones, and her cardiovascular system, and maintain feeling without hot flashes, night sweats, and other obvious types of emotional symptoms. Let's look at progesterone now. I've already talked about it. It's synergistic with estrogen, and it's the first hormone needed, because when the ovary stops producing eggs, they stop producing progesterone, and so it's going to be the first hormone that's going to be needed to be replaced. And it is crucial to have it prescribed along with estrogen, if that's going to be necessary, in order to modify the proliferative aspects that estrogen does. Progesterone in women is the major anti-inflammatory hormone. So without progesterone, inflammation becomes a chronic problem. With progesterone, it is brought into a more normalized balance, and that is key. Progesterone will resolve the hot flashes and the night sweats. It is the primary hormone to keep a woman cool, calm, and collected, and so it will stimulate feeling calm and help to prevent anxiety. And the primary side effect of oral progesterone is it makes a woman sleepy. So ideal, because during this time you have lots of problems with sleep disturbance. We can enhance sleep, normal sleep functions by adding progesterone, and it makes a huge difference. I much prefer using oral therapy with progesterone and topical therapy with estrogen. Topical therapy with estrogen avoids the first pass through the liver, which can cause using an estrogen to become more, cause more blood clots in the body, because it increases the coagulation potential. So let's talk about the third hormone, and that's testosterone. Testosterone will increase the sense of well-being, improve mood and energy, decrease the tire that wraps around our abdomen, our visceral fat, improve muscle strength and stamina, increase bone density, increase skin thickness, improve insulin sensitivity, improve libido, improve memory, cognitive function, and sleep. That's a whole heck of a lot of stuff that you can get out just using testosterone. But testosterone is always going to be in balance with using estrogen and progesterone together. But the reason I mention it, even though a woman has only about 1/10 of the amount that a man has of testosterone, that testosterone is absolutely critical for maintaining health and well-being, as the woman continues to age. And I use, for women, testosterone, again, in the form of a topical cream. Never, for men or women, do I use testosterone orally. That would increase the potential risk of developing a tumor, which could be a cancer in the liver. So I don't use testosterone orally. I use testosterone topically. So estrogen topically, progesterone orally, testosterone topically. I can use progesterone topically as well, but the absorption is much more problematic through the skin. If I'm going to use it, the place to apply it would either be to the backs of the hands or the tops of the feet, and then I have to monitor them a little bit more closely to make sure I get a woman into a therapeutic range and that I'm not just kidding myself, or by kidding myself or kidding ourselves, we're then having unopposed estrogen stimulation without the importance of progesterone to counterbalance that. So those are the three hormones that I focus on, and that's what I'd like to present today.